So here are those resources at a glance, what we're going to cover today. First, I want to say that each of these resources was developed separately for different reasons, and sometimes as part of different partnerships or projects. So for this reason, there's some overlap in the content contained within each resource, and some resources may be better suited to you or your organization's needs compared to others. So we're hoping that today's webinar will help you decide what's most relevant to you and which you'd like to access, or maybe all that you'd like to access. We'll overview an introductory online learning course first, then 3 sets of webinars, and then we'll look at a middle manager learning pathway, so a learning pathway that was designed specifically for middle managers and team leads. I'm just going to pause here and say that you may remember that when you registered, you indicated which resource you would be most likely to discuss in a small group, or which resource rather that you would prefer to discuss in a small group. And that's because later when we try and go into breakout groups, we're going to do our best to match everyone's preference. So if you can possibly do us an extra favor here, it would really help us to sort you out. It would be great if you could rename yourself with the number of the resource that you're most interested in. And you can use the numbers that are listed here. So if you want to use, if you want to talk about the webinar training program on health equity, then you would name yourself with the number 2 first, and then maybe an underscore, and then your name. And I've actually done, I can actually do that right now as I'm speaking to you. And the way that you do it is you click on that list of participants. So you bring up your list of participants, and then you hover over your own name, and you change your own name. So you can do that by renaming your name. And I have some colleagues who are going to give you some instructions as to how they can do this in the chat box. So if you haven't already done that, if you're not familiar with Zoom, feel free to do that in the chat box there to get some information on how to do that. I see many of you have already renamed yourself, which is great. So if you need any extra information on how to do that, let us know. Okay, great. So without further ado, let's get into some of the actual information on each of these resources. And I guess even before that, I wanted to ask all of you if you had actually used the resources before. So if, sorry, I'm going to ask my colleague Sume. Sume, are you able to bring up that poll for me? If you've actually used the resources before. If you have, then it would be great to hear. So I'm seeing that a lot of people have not used any of these resources before, which is great. That's what we can tell you. And some people, a few results are coming in now. So we've got some, not a lot, 7 out of 54, or 6 out of 56, or 10 out of 56. So a very few people have used some of the resources like the online course and the webinar series. And I'm not seeing any results for the learning pathway for public health middle managers. So that's interesting to see. So thank you very much. We can end that poll now. Perfect. And I wanted to ask you one more question before we jump in, which is, have you, are you practicing, there's a second poll, so if you can pull it up, that'd be great, which is asking, which of the following best describes you? Are you a public health leader choosing resources for your team? Are you looking for your own professional development? Okay, that's great. That's what I'm seeing so far. Are you assigned to a specific role to find resources for your team? Or are you a university course instructor or a public health student? Okay, so far I'm seeing the majority of people are looking for their own professional development. And a few others ticking the other boxes. Okay, well, that's great to hear. Thank you so much for that. Okay, great. So we can close up that poll now. Thank you very much, Sume. All right, so before we get started individually looking at the actual resources, I wanted to tell you some of the common features across these resources. And really, One of the first things to say is that each of the resources we'll explore today contain high quality content and yet are relatively brief. They are designed for self-directed learning. They can be used to meet disciplinary and competency requirements, training requirements, or personal learning goals. They're also flexible, which means that you can engage with them on your own or with a group of peers. And you can stop, start, and return as needed, depending on what content is most useful for you. So as an organization, we'd love to hear about if you do choose to use these in the future, how you're embedding them into your either orientation or training or learning assignment processes. It's great for us to hear that kind of information. The other thing that's common across all these resources is that they were designed in a way that accounts for the fact that we all learn differently, and that health equity learning and action often requires self-reflection, group discussion, and actually hearing about concrete examples of public health in action. So how is public health actually addressing the social determinants of health? And finally, it's nice to know that these are presented in different and sometimes multiple formats. So that means that they include both written, video, and audio aspects, all with links to related resources. I just wanted to put them up here again just before we launch in case you didn't get a chance to look at the at-a-glance slide. And the first resource that we'll be talking about, as I mentioned, is the Introduction to Health Equity online course. So this course was designed in partnership with Public Health Ontario. And of course, like all of our other resources, it's free. But I say this because it's a question we get asked a lot, is this course free? So it's free and it's available online. It was designed to provide public health staff and managers with foundational knowledge on health equity and the social determinants of health, as well as facilitate learner reflection and illustrate health equity, organizational capacity building. So there's a whole module on that. And finally, provide examples of effective health equity action by public health. And I mentioned modules. Well, there are actually 5 modules in this course. The first is what are health inequities? Then there's a module on pathways to health equity, acting to improve health equity, reflections on worldviews, and building organizational capacity for health equity work. And each of these modules is about 30 minutes each. So that means that the course takes about 2.5 hours in total to complete. It includes relevant terminology, so what various different words mean, explanations, video content explaining core concepts, links to related resources, and practical scenarios representing national and international evidence. And our in-house expert on this course, because she was the lead for helping to design it and making it all happen, is Dianne Oickle. And so if you're interested in talking about this course, later when we go into breakout groups, you can rename yourself as _your name to be in a breakout group with Dianne. The second resource that I want to introduce you to here is a webinar-based training program on health equity. And like the online course, this next resource also provides introductory training. It has 6 webinars, and each of them are under 40 minutes, and each of them are available in both English and French. And I realize now I didn't say this about the online course, it's also fully bilingual. And it's also, the online course, it has a few differences that are worth noting though. So the online course I was talking about previously is more accessible than this series because there are actually PDF versions available. And second, because this webinar series was offered as part of Ontario's public health training Public Health Training for Equitable Systems Change, it's a great acronym, FESC project, these webinars were designed to support Ontario public health units to put the health equity guideline into practice. And that being said, we think that they're still highly relevant for public health staff in other jurisdictions. So that's just one difference to note between these webinars that also provide introductory health equity content and the online course. And as you can see here in this list, the first webinar in this series introduces the concept of health equity. The next 4 webinars closely follow the content in Ontario's health equity guideline, which in turn is aligned or rather informed by our 4 NCCDH public health rules for improving health equity. So those are assessing and reporting on inequities, developing equitable interventions or modifying interventions so that they are designed to accommodate to address inequities, collaborating across sectors, and fourth, to participate in policy development. Something that's unique to this series, at least as far as it compares to others, is that it devotes a full webinar to racial equity and embracing a decolonial anti-racist practice. However, this series does not dedicate much attention to, like, it doesn't have a whole module or webinar devoted to building organizational capacity for health equity. So as I mentioned, that's something that the online course really does spend time on. So that's just something to note between the two. I also want to mention that each of the webinars that I'm talking about here, the webinar-based training program, comes with these handouts that contains related resources and discussion reflection questions. The next resource that I want to tell you about is another webinar series, and it's a collaboration of the NCCDH and Health Promotion Canada. And these webinars highlight several chapters of the 4th edition of the book that you see here, which is Health Promotion in Canada. And our resident in-house expert on this webinar series is Lesley Dyck, and she's available there on the line, and she'll be leading a breakout group on this later. So if you want to talk about this, you have to name yourself with a 3 at the top of your name. Thank you very much. The goal of these webinars, and you can see them here on the screen, is really to explore how various themes in the book apply to public health action on health equity. And so you kind of get a sense of that by looking at the titles of each webinar, because each one covers a range of topics, including applying an ecological approach, looking at interventions, health inequities in policy, Indigenous community health promotion, health in all policies, and participatory practice. And each webinar also pairs the author's content with more practitioner applied perspectives. So that's good to know, because it's extending the content of the book with that practitioner perspective as well. And in this list, we've also linked you to 2 related webinars that were produced by our peers. One is from Health Nexus on gender transformative health promotion and addressing violence against women, and another is on planetary health, called Population Health Promotion in the Anthropocene. And that's a webinar by Trevor Hancock. Oh, I have pressed something. 1 second. Are you still with me seeing my screen here? Okay, great, we're back in business. Sorry about that. The third set of webinars that I'll tell you about here is one that we put together. It wasn't designed as a series, but it's a grouping of webinars, and each of these webinars has related resources that when you click on the webinar link, you'll see. And those really serve as a substantive primer on racism, anti-racism, and racial equity as relates to public health practice. So because they weren't developed as a series, but rather a collection of webinars, some of the content within them could overlap because they all contain introductions that were developed differently, like separately from each other, but we really do encourage you to view them together as a group and to do so in a specific order. And that's because we think that the content that they contain, when used within organizations, can create the space for having important discussions about how public health and the larger community should recognize racism as an oppressive system that harms health, should know how to disrupt racism and colonialism in active ways, and how to collaborate to actually invest in healthy communities. So here I suggest you see these in. The first is Racing the Social Determinants of Health and Health Equity. And the second is actually, we pulled a webinar from that first series that I talked to you about, the Health Equity webinar series. It's called Racial Health Equity, Embracing a Decolonial Anti-Racist Practice. The third is, Can Understanding Whiteness Improve Anti-Racism Activities in Health? And the fourth is Racing the Social Determinants of Health and Health Equity, Part 2. The fifth is Disrupting the Color-Coded Labor Market, Implications for Public Health Organizations. So that's how we suggest that you view them in that order. There's also another few webinars that we've pulled in here into this cluster. One is available in English and in French, and that's the focus on, it has a focus on intersectionality. and we did this in collaboration with the NCC for Healthy Public Policy. The other two that are listed there have a focus on working with specific communities. One is on Indigenous community health promotion and was pulled from the health promotion series. And the other is actionable ways to address anti-Black racism and police violence through public health practice. So finally today, I want to tell you a little bit about what we call a learning pathway, and it's designed, as I mentioned earlier, for public health middle managers. So this is a guided learning pathway. It maps resources along 5 competency domains that have been specifically adapted to health equity practice and to being a manager in public health. And the first domain is to create vision and strategy, and it focuses on why addressing the social determinants of health and health equity is important, how to communicate about this, and what to do about it more generally. The second is mobilize people and achieve results, and it focuses on how to facilitate health equity action. So that means it includes content on the competencies and skills and rules required for health equity work and how managers can support this. And the third is uphold integrity and respect, and it focuses on racial equity, intersectionality, and understanding oppressive systems. And the fourth domain is to collaborate with partners and stakeholders. It focuses on intersectoral collaboration, collective impact, and integrating a wide range of perspectives. And finally, the fifth competency domain is to promote innovation and guide change. And it focuses on universal and targeted approaches for health inequities, and as the title suggests, on guiding change. So while this resource was designed for self-directed learning, each cluster of resources within each competency domain are presented with a significant amount of guidance. And what I mean by that is that there's a clear progression for learning. So for each domain, you're asked to take steps. First, you're asked to review the individual competency statements, and then you're asked to take the pre-resource review self-assessment quiz. And then you're asked to actually review the selected resources. And some of them are core and some of them are listed as additional. So if you don't have time for everything, you must read these. And if you want to read more, you can go beyond by reading these. And of course, when you are told about each resource is presented with reflection questions to guide your reading and links to each of those competency domains. So when I say that there's significant guidance along the progression of learning, that's what I mean by you're kind of guided within the document as to how to approach your learning and your thinking. And to take the post-resource review self-assessment quiz, which is 10 questions long. And I put here on the screen one of those questions because I personally found them to be a kind of interesting part of that resource to go through the different scenarios that are brought up within those post-assessment questions.